Morning. Uh, I have a few words before I go to my slides. Number one is most of my slides have been borrowed from other speakers, given lecture in different times. Only one or two probably is recently prepared. So I declare this. And second is most of the content of my slides have already been presented by the 4 or 6 speakers. So I'll just speak most of it, but will touch the few things which I think necessary for recent context. 10 years since the resolution, I assume that this resolution is the UN WHO resolution 67.19 probably, and I assume that we probably meant not the whole world but the Bangladesh. So these two assumptions I have made, though Robert Twycross mentioned that when you assume something you make an ass out of you. So I hope I haven't done that. I hope that this resolution, what they meant, which was declared back in 2014, and the 6719 agenda, it is a 5-page resolution. And this 5-page resolution basically says that all the member states of the World Health Organization should consider strongly that integrate palliative care in every stage of the healthcare service. And when they meant, and throughout this whole resolution, 5-page resolution, it was more they wanted to specify the primary health care where more palliative care should be integrated at every stage though, and secondly to make morphine available whenever it is necessary. These were the main theme of this resolution, and when the title says that 10 years from the resolution, where do we stand now? So before coming to the Bangladesh issue, we can have a quick look at, as I said, that it has already been mentioned, that how many people in this world needs palliative care. And then at this point, I mean, this is from the 2020 data. It says that only probably 14% of the people who need palliative care all over the world gets it. Don't forget that majority of this 14% belong to the global north, and only a very few percent are global south. We underdeveloped or developing nation, whatever you call it, has an access to palliative care. So my focus is basically will be on Bangladesh. The problem, you all know these facts and figures. The only thing that I would like to show you here, the per capita health expenditure is $50. And with this per capita health expenditure and out of pocket expenditure of 74%, even primary health care cannot be offered to our 180 million people. Nowadays it has gone so high. This we should never forget. And we should also never forget that regarding this developing world, is a unique word, developing. This is a very sober word instead of calling it a poor country. Uh, and for a developing country, the fun is whatever statement you give can be used both way, either right or wrong. That is the most interesting phenomenon about this developing world. However, trying to remain confined to the subject which I've been told to talk about, that Bangladesh stands in the level 3A position, again from Global Atlas. And 3A means that isolated, patchy initiatives here and there, and not even properly integrated with the state health policy. So that is what is 3A. And should not forget that in 2015, the Economist Journal brought out an issue on the topic of quality of death index. Though I have lots of reservation about this survey, but nevertheless, Bangladesh stands on the 79th position out of 80 countries, and the 80 was Iraq. And this whole quality of index issue was assessed on the availability of palliative care. Again, I am just showing it because, again, I have to show this Western facts and figures to draw your attention. But then again, there are issues which needs to be probably elaborated. And also, when we say that where we are now, our per capita morphine consumption remains 0.05 milligram per capita, where the global mean is 6 milligram per capita, which, if I remember correct, Romana, they visited one program, the Wisconsin University. They did a survey that only for palliative care patients, for the patient with suffering with cancer pain, 1200 kgs of morphine is required, right? And Bangladesh, up to now, the highest probably they have used 12 kg. At our time, I mean, I'm an old generation, we found out that it was only 3 kg maximum was used. So that is where we stand. As I said, that any statement about developing world can be used in both ways. We have done fantastic in palliative care journey, or we haven't done anything in palliative care journey. So both the statements can be elaborated. So let me take the sort of privilege of saying what have we done really in Bangladesh, where do we stand now? And this history actually, though it says that since 2014 when this resolution was taken, the journey began much earlier, much earlier. And these were individuals' issues, individual endeavors. I with great respect, remember Brigadier Rokia Suraya, our respected Salmapa from Ashik Foundation, Rumana Dola, who has been mentioned by the president of the Oncological Club. But these are the individuals who initiated this, I mean, who floated this word palliative care in this country. We can't, just because of this resolution, we cannot afford to forget their contribution. And even before the resolution came, we did a national situation analysis throughout the country, and However, probably the most important and significant step that took place in this journey was the establishment of the Department of Palliative Medicine, indeed an only medical university of the country. And I have put this picture for one reason. This is probably the only department in the history of the medical university where the definition of the discipline has been put in the main island. I mean, you won't find it. I mean, no, the Department of Gynecology doesn't write what is gynecology. Now, why this was necessary? This was necessary because learned colleagues never came across the word palliative often, and to some of them it was a place for death and dying, to some it was a place for compassionate, tender, loving care, but almost nobody, or so for some it was a pain clinic, for the most learned colleagues it was a pain clinic, but nobody had an idea that this is an evidence-based medicine, so we had to put this definition there. It stayed there for probably a couple of years, right, Noreen? And then one day fell down, and then we did. By that time, people came to know a little bit about palliative care. And then the outpatient department established in 2017. Now I'm coming to the issue of the Lancet Commission report says we do not have any authentic data for this country. Absolutely no. But Lancet Commission says that we have a total number of probably 600,000 patients needing palliative care and 39,000 children. Now we all copy these things from the outside source. However, that is the situation, and we also learn it from the global atlas that we are in a position 3A, isolated palliative care provision. But this university department still remains the pioneer. So, what are the other facilities? As I said, the Ashik Foundation, a bereaved parent, they developed the first probably seed of the palliative care, though it was actually 1996. Okay. Long before 2014 resolution. So that was initially a shelter for children coming for oncological treatment. Gradually, that's how, what I'm trying to emphasize is that history is never made by one person. A number of persons gradually put their effort, and it happened. Now, as I said, that this is the most probably significant practically establishing Department of Palliative Medicine back in 2007, and all these are there. I think I have only 1.2 minutes left, so I'll be very fast. And when this department developed the curriculum for Masters in Palliative Medicine, people often accused us of drawing a cart before a horse, because when people didn't know what is palliative care, how could we manage to go? But this was about not missing the train that we had. So, MD in palliative medicine, both way you can say. And since then, up to now, we have probably 11 specialists. We can say the specialist. I'm not a specialist. I have only 6 weeks training in basic certificate course in palliative medicine.
Because we didn't have anything.
Yeah, but this 11 persons, they are trained for 5 years. So we can talk about it. This is another map that one of our student, he had made it region wise, because whatever initiative there is of palliative care, all is focused in the capital city, nothing outside. Number of researchers are coming out. I would like to go only these 2 slides. Why we are in such a poor condition. I even quite often remember this Albert Einstein's: more the knowledge, less the ego. Lesser the knowledge, more the